always say, never let a good crisis go to waste. And certainly something that I'm experiencing firsthand and with my colleagues is the demonstrable leadership, firstly, of our President Ramaphosa, and our Minister of Health, Dr. Zweli Mkhize. You know, when you're at a company like Aspen, which has an extensive global reach, like we do, you get constant feedback on a daily basis from your staff around the world. And certainly the impression that we've made in South Africa under the Minister's leadership has left a very good impression across the world. We get particular feedback from Europe. It's also heartwarming at the levels of cooperation and collaboration that are taking place between the private and the public sector. Many say that the public and private sector can never work together, and I think we're establishing a very strong foundation and platform for the future. The second of the three remarks I wish to make is I wish to give you a sense of how we are approaching the support for government, how we're collaborating with very generous donors. I want to give you a little bit of insight into that, and also to ask for your help as media. We're not underestimating for 1 minute the role that the media plays in defeating this pandemic. We will defeat it, but we need to draw on every energy and resource in the country, and the media for us is a very critical element to that. What we've done is in the health stream that I'm leading, and I had to say that I'm leading it because there's a team, an extensive team of people that cuts across the depth and breadth of private healthcare in our country. It's strongly underpinned by significant pro bono resource. That pro bono resource comes from the four... Sorry.
No, it's okay, Minister. It's okay. It's okay.
Is this okay?
Sorry.
Apologies, guys.
Come nearer.
Okay. I was just saying that...
Don't come too near.
At least I'm a Sundown supporter. That's a good thing. So, I was just saying that for business to play that complementary and supportive role, we've got to look at where our strengths are to complement our government. And one of the things we've been able to draw on is extensive pro bono resource from the top four, or the big four audit companies as they're called, the big four law firms, and many of the consulting firms. That's given us significant resource. There's a lot of work that has to go into this. There's a business we had to set up to do this importation in the space of 5 days. It's record time. So I wanted to give you some of those insights, and then I'll move to my final point. The 6 substreams in the public health cluster are data and analytics. So we are doing modeling of the pandemic. It's very important information. We will be sharing that with the Minister. I think on Friday we agreed, possibly Minister, so that we can share some of the insights and we can coalesce around modeling. Modeling is very important in terms of managing not only the public health response of the country, but we have our eye very clearly set as business on the post-COVID economic recovery period. And having this information is critical to making informed decisions on and where we place resource and investment moving forward. There's a group that's doing medicines and vaccine security, a group that's doing testing and pathology laboratories, a group on communications, a group on geospacing and mapping, and then finally a group on PPE and medical equipment security. It's that one that I just want to make a comment on, the latter group. Clearly PPEs are a priority, we all know that. We as business, and we share and we are aligned with our government that there are good things in being second in life and there are bad things. So China is in week 19. We're in week 4 here in South Africa. And I think if you look at our performance in week 4, we're doing pretty well, I believe. You can always improve, of course. You can improve anything in life. but it's enabled us. I say it's a good and a bad thing. It's good because we were able to learn from the experiences of other countries. It's bad because China and all the others whose pandemic started a lot earlier than ours bought all the global stocks. So now you're sitting with that situation. So there's a good and a bad part. So to put it in perspective, there's 180 plus countries right now, as Minister Keys has said, that are vying for the same global pools of PPE and other equipment inventories. And we've had to leverage on, as the Minister said, bilateral and multilateral relationships that our country has. A few years ago, under the great leadership of Patrice, I served on the BRICS Business Council. And it's incredible how we've been able to leverage that now, and people still remember Patrice. Of course, they remember the current leadership of the BRICS Business Council under Busi Mabusa, but these are historical links that have been built. So I think there's a message here. You know, sometimes we question what do these relationships actually bring, Minister Keys, and now I'm seeing it firsthand, that you're able to freely reach out to people, and they are pulling out the stocks where they can. So let me move on to finally the structure that we've set up, and then I'll pause there. Yes. Okay. So the situation on PPEs, and one of the things that we've been working on, and we can only work on it because government has relaxed the competition provisions in the country. Previously, you could never have companies sitting together and checking what inventory levels there were in the country. It would have been anti-competitive. You could never sit and speak to Minister Nkiz's tendering team. It would not have been, from a governance point of view, not have worked. Now we're able to sit together and we're saying we're putting the country first. COVID must be defeated. Let's establish a common database and dashboard. This is a dashboard that will be ready on Friday. It will give the Minister real-time visibility of medicines and vaccines stocks in the country. Obviously, what we can't give is what's already in the trade. So we can't tell you what's sitting at Chris Hani Baragwanath or at Morningside Pharmacy. But what we can give the Minister sense of is what's sitting at the suppliers, the manufacturers, and what's coming in the next 6 weeks. And that's an important visibility to have. In assessing this visibility, we realized, the Minister realized, because we went to him, said, but we're going to have a problem in the next 2 to 3 weeks. We can't get the stocks in quickly enough. What emergency or rescue measures can we put in place to bridge us or tie us over in this 2 to 3 week period? We're entering a critical phase in the pandemic, and it's a phase where you're going to have a lot more patient contact with the frontline doctors and health workers. I must say pharmacists also must be on the line. We must never forget them, like myself. So I think that's how the conversation came about. We were able in a very short space of time to put a team together that does sourcing, procurement, the transactional component, the commercial component, freight forwarding and clearing and fine distribution to the facilities. Put that all together, and we've gone to source product where our local suppliers cannot source product from. And I'm happy to tell you, you can only do this if you've got your donor funds behind you, because this...
All right, that's Stavros Nicolaou of Aspen, just giving a briefing to the Health Minister about his efforts along with the Motsepe Foundation in terms of getting things like PPE and other equipment. We're going to say goodbye right now, and of course our colleagues at SA Today will give you more news. Do take care.